Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Peritoneum over the uterus. Peritoneum around the uterus and the whole peritoneum or broad ligament. Actually, broad ligament. Broad ligament is a misnomer. Broad ligament does not support the uterus. Broad ligament is a fold of peritoneum with anterior leaf and the posterior leaf going over the uterotubo-ovarian pedicle. Broad ligament is of three types, three parts. Mesosalpinx. Mesosalpinx is the part of broad ligament lying near the fallopian tube. Mesometrium is a part of broad ligament lying near the uterus. Mesoovarium is a part of broad ligament lying near the ovary. Round ligament indirectly supports the uterus and it is a secondary support. Contents of broad ligament. Contents of broad ligament include blood vessels like uterine and ovarian vessels and nerves, round ligament and ovarian ligament. Artifacts or vestigial structures of the broad ligament include apoeuperon, paraeuperon and Gartner's cyst. Gartner's duct are the vestigial structures. Oviduct is also called as fallopian tube, is a content of broad ligament, whereas ovary and ureters are not the contents of broad ligament. Blood
thank you and thank you for watching.